Good afternoon. Today we are here to discuss the state's response to the international situation known as the novel coronavirus and provide information that Kentuckians should follow to help them be healthy. First, let me be very clear. No one in Kentucky has been diagnosed with the novel coronavirus. We have 0 confirmed cases of this form of coronavirus. We want to reassure the public that we believe the risk to Kentuckians is also low. Let me say that I understand the concerns that people have. I'm a dad of 2 incredible kids, and something like this is scary to parents. And it's scary to those that have parents that are now seniors and that might be those that would otherwise be at risk. But I want to reassure everyone that your state government, your local health departments, everyone is prepared and is ready to address this issue head on. And I feel very strongly that our work will have us prepared if and when we see a confirmed case. That's why it's critical for every Kentuckian to know the most important steps that they can take, and that those steps are pretty basic. Steps that you would take when preventing the seasonal flu or the common cold, like getting your flu shot. If you haven't gotten a flu shot, go get one. Staying home if you don't feel well. Don't come to work if you're sick. I've been telling people in state government that. And also properly wash your hands. Incredibly important to stopping the spread. These are steps that not only help protect yourself, but help protect other Kentuckians around you. And these are the same guidelines that the CDC recommends. To help ensure Kentuckians know where to go for the best up-to-date information, we're also announcing a new website. The site will help to answer public questions and support our medical community as information becomes available on the site. It is at http://kycovid19.ky.gov. That is kycovid19.ky.gov, and it will be updated with the most recent information as we receive it. In addition to prevention efforts, my office is working closely with the Kentucky Department for Public Health to monitor this situation internationally and nationally, and we are taking active steps to be ready and to be prepared. Our State Health Operations Center has been activated at Level 2, which means we are focused on preparedness, planning, and response activities. Our Public Health Department is contacting and monitoring anyone who they are aware of has traveled in the last 14 days from China, the primary country of concern, to determine if they develop any symptoms. While the situation is rapidly evolving, our surveillance efforts will evolve as well to make sure we are doing everything necessary. We have asked these travelers from the last 14 days that have traveled to China to self-isolate, to avoid public gatherings, and report their temperatures and any symptoms daily. Thus far, we've monitored over 100 people up to this point. Now, most of these are travelers that have already passed the 14-day monitoring period, and all but one have been illness-free. The one person who had symptoms tested negative for the novel coronavirus. So again, we have no confirmed cases of the novel coronavirus in Kentucky. And while we are taking steps, making sure that we are monitoring any folks that potentially could have been exposed to this point, we do not have a reason for concern. Again, no one in Kentucky has tested positive, but we have a strong response and monitoring system in place that is already active and ongoing. But as you know, the virus is spreading to other countries like South Korea, Japan, Italy, and others. The risk in these countries is very low for people traveling there at this time, but again, we are prepared to monitor anyone who we think has traveled to these countries if it becomes necessary. International travel alone or going through airports in other countries other than China is not currently considered a risk for the virus at this time. We're also coordinating with the Kentucky Emergency Management on state-level planning with our partners. And we are assessing and reviewing our response plans for Kentucky and our equipment and resources. Dr. Stack will provide more details on these plans shortly. I also want to note the expansiveness of our response. We are coordinating among state governments and our state public health partners. And we have also heard from both the University of the University of Kentucky and the City of Louisville, who held press conferences today to help Kentuckians understand and to make sure they keep people informed that they serve. The City of Lexington is also taking steps to prepare, as well as the University of Louisville and many more. This is a national and a global effort. The Cabinet has been participating in regular updates with the federal government to address national concerns and to coordinate with our fellow state leaders and experts. And let me say, I believe the federal government has done a good job in providing us with up-to-date information. There have been, for governors, almost weekly calls directly with Secretary Azar, and there have been multiple calls just about daily with the Cabinet. We feel like we are getting good information and good support from the federal government. It is clear that we are all working to make sure that Kentuckians are protected and have awareness on how to take the best steps for their family. I want to thank everyone for getting the word out in Kentucky. All of our partners, including you who are here today in the media. Now listen, something like this for so many families and so many Kentuckians, it can be scary. But we want to make sure we have the right information out to let people know that we do not have a single confirmed case in Kentucky, and that while the risk is low, there are some things we can do to take care of ourselves and of each other, again, that include really washing your hands, making sure you get that flu shot, and if your kids are sick, regardless of what they have, and they're infectious, don't send them to school, and please don't come to work if you are sick, because everyone out there plays a key role, whether it is influenza or this novel coronavirus, in making sure that it does not spread here in the United States. As you will hear from Dr. Stack and Secretary Freelander, we understand that this is rapidly evolving across the United States, and that's why we are working daily to make sure that we are up to date and we are prepared, and our goal is to be prepared no matter what this virus throws at us. We're learning more from the Federal Centers for Disease Control and Prevention officials every day, but risk of illness is based on exposure, and in Kentucky right now, that risk is still low. And I know that our public health experts and state officials are doing everything under their control to be ready and to address it. Let me say, whether it is our public health departments out there in the state or whether it's what they're doing here in Frankfort, this is a level of preparation that is incredible to see. The steps that people are taking, knowing every extra minute that we have to prepare, gives us more opportunity. I've been very proud of everyone involved in public health and the work that they are doing. And it's our job, and it's my job, to make sure that people stay informed and understand what we're facing. I want Kentuckians to know that I have every confidence in the information that is coming out right now, and that we will be transparent as the situation evolves. We will make sure that all those families out there that are nervous are kept up to date, and they'll hear from not only our public health officials, but as things evolve, they'll hear from me, their governor. So with that, I'm going to hand it over to Secretary Freelander, and then we'll hear from Dr. Stack.
First, I want to thank you, Governor, for calling us together today to help elevate our public education and response efforts. Governor Beshear has supported us since we first learned of this virus. Through his steady leadership and our strong information network, we are prepared to fulfill our Cabinet's mission to protect Kentuckians and to enhance their health, safety, and well-being. It is the mission of the Cabinet and the Department for Public Health to ensure that health and safety for everyone in this Commonwealth. Because of my 30-plus years in the Cabinet for Health and Family Services, I understand this mission and all the ways the Department for Public Health is prepared to protect the Commonwealth in times of illness, outbreak, emergencies, or any instance where the public's health is threatened. The structure for disease surveillance, reporting of communicable diseases, laboratory testing, and clinical intervention and response is well developed and works for this Commonwealth every day. Our local health departments and network of clinicians across Kentucky serve on the front lines of care and are prepared to track and report health threats in our community, as well as respond when any need emerges, and that includes diseases like the novel coronavirus. I want to pause here to thank Governor Beshear for recognizing the importance of this local health department network. This is vital infrastructure for all of Kentucky. So thank you for including retirement costs for our local health departments, because that's critical to keeping that infrastructure alive and well and able to respond to issues just like this. Our team of scientists, physicians, nurses, and staff members within the Department for Public Health are leaders dedicated to providing guidance and resources to local communities, coordinating with our partners at the federal level and at the local level, and keeping the public informed. We have a strong relationship with the Kentucky Hospital Association and its member hospitals and other local providers. They report when they see something in the field. As the governor mentioned, we have established procedures in place for how we collaborate with the Kentucky Emergency Management System. This entire network has been built to protect every Kentuckian. The people who serve in these roles have dedicated their lives and careers to serving and protecting the public health. My team has developed many resources. Our team, Team Kentucky, has developed many resources right here. We stood up our website very recently. It is the place to go for the most recent information. And finally, wash your hands, get the flu shot. I'd like to now take the opportunity to introduce Commissioner Stephen Stack. Commissioner Stack has worked in emergency management, has led emergency departments in Kentucky, as well as has been the president of the American Medical Association, the youngest in 160 years. He is well qualified. He has worked well on the federal and state and local level relative to health policies across the Commonwealth and across the nation. I feel very lucky and very comforted to know that the Department for Public Health is in such steady and well-respected hands. Thank you.
Thank you. Governor. Good afternoon. Thank you, Governor Beshear and Secretary Friedlander. As Public Health Commissioner and as a practicing emergency physician, I'm honored to serve with this group of dedicated public health experts and public servants who have been so diligent about surveillance and efforts concerning this novel coronavirus known as COVID-19. I just returned from Washington, D.C. last night, where I met at the White House with federal officials, fellow state health officers, and local health department leaders to coordinate a consistent and effective national response for this illness. The U.S. is a leader in healthcare technology and public health science, and we are rapidly deploying these assets to bring about positive developments such as COVID-19 testing to diagnose the disease and expedited vaccine development to prevent the disease. Here in the Commonwealth, we are also doing our part collaboratively with national, state, and local partners to prevent when able and reduce when possible the potential impact of COVID-19 on our communities. The situation is rapidly evolving. As the governor has shared, the potential global public health threat posed by this virus is high, but the immediate risk to Kentuckians is low. The disease began in China, but is now spread to at least 42 countries. Public health response efforts in the United States have been very well executed and have delayed the spread of the virus within the United States, but this will become more difficult. At this time, though, we have monitored a little over 100 patients, as the governor has informed you, and they've had possible risk factors but no active disease and no confirmed COVID-19 patients in the state. While this is reassuring, experts at the CDC have advised caution and encouraged broad-based planning to ensure that we can control and mitigate any potential future consequences as best we are able. As we escalate our preparations across the state, I, too, urge every Kentuckian to take routine precautions for flu and other respiratory illnesses. Now, I know all three of us said this, but this is important. Wash your hands often with soap and water. Children need to know about the soap and water part. Alcohol-based hand sanitizers can be used when soap and water aren't available. Cover your cough or your sneeze with your arm or a tissue, not with your hand. Stay at home if you're sick, and if your children are sick, keep them home from school and get a flu shot. As this situation evolves, we encourage you to check the website we've introduced to you. That will continue to evolve and have increased resources over time as the situation continues to develop. And I want to reassure you and let you know that I have high confidence in our healthcare system in the state of Kentucky and the professionals who serve you every day. And I think you should take great comfort that you have a network of very dedicated people working very hard on your behalf. I thank the governor and the secretary for their leadership and the support they provide our services. And I thank you for your attention to this matter. Thanks.
Before we open it up for questions, we have a lot of hardworking state workers and officials that are here. I also want to acknowledge we have Representative Moser, who's here, who has a strong public health background, and while we were planning this press conference was encouraging us to do so and to get out the word. We're lucky to have you in the General Assembly to help guide us on public health matters. All right, let's start with questions on this. Yes.
Does the state have the ability to test for the virus, or is it sending it to the CDC? And how fast is the turnaround time on that?
Well, we just had some recent news on that.
So the testing is currently being done at the CDC. The CDC has committed to a 24-hour turnaround when they receive specimens. There are labs in the state, diagnostic labs, that are getting ramped up, and we hope within a matter of days we'll be able to provide those tests here in Frankfort.
One quick follow-up. How many people have been tested so far?
There's been one person in the state of Kentucky who was tested, and their result was negative.
And so if I can, that's an example of, while the threat may currently be low, we are using every extra moment that we have to prepare. So right now, tests would have to be sent to the CDC for a one-day turnaround, but we are working to make sure we can do that in Kentucky and hopefully reduce even that timetable. But again, when you look at those numbers of everybody that we've been monitoring, only one has shown symptoms of that entire group, and they've tested negative.
Any extra precautions going to be taken because of Derby and Keeneland?
I think it is early, given especially where the fact that we've had no one confirmed. I think this is a wait and watch, but I wouldn't make any or suggest any drastic steps unless we see change at our current status quo. But again, I would encourage everybody to wash your hands, stay home if you're sick, and get your flu shot.
There's been a lot of criticism at the national level of Trump administration being prepared for an outbreak like this. You said you're getting great communication from the federal level. Do you think that criticism has been unfounded?
Well, I haven't personally seen either the testimony that I think that's come out of. All I can say is we have had significant communication directly with me as governor, with our Cabinet for Health and Family Services, with the CDC, with the administration. We feel like we've gotten a lot of information. I have no criticisms of how the administration is working with us. They've been a good partner.
Those 100 people you mentioned, what prompted you to take another look at them? What was the situation behind it? Can you tell us what part of the state that was?
Well, those 100 people were folks that had traveled to China within the last period of time. And so it was a precaution, and entirely a precaution. Most all of those are out of the 14-day window that we would look at, which means that we're pretty sure they're out of the woods and that they won't have any symptoms. And again, of those 100 people, only one had symptoms. So it's entirely preventative. But that's the type of planning and preparation that's necessary to make sure if and when Kentucky has a case that we already have these practices in place to make sure that it doesn't spread.
How are those individuals identified, and is this sort of self-monitoring process voluntary?
Yeah, let me ask Dr. Stack.
So the Center for Disease Control gives guidance on individuals they feel are at risk, and that guidance evolves as the situation changes. The illness originated in China, and until recently, 99% of all the cases in the world have been in China. And even though these numbers change so rapidly, more than 95% of all the global cases have still been in China with recent data reported. And so identifying recent return visitors from China has been a key identifying way to determine who should be monitored voluntarily. We have a process in place to request voluntary monitoring. Individuals are asked to sign a document. I think people should take good confidence that our fellow Kentuckians have overwhelmingly voluntarily complied with that request out of consideration for all of our well-being as well as their own. And then as the situation evolves globally, the individuals identified for voluntary monitoring or other types of surveillance will evolve as the situation changes. So all those individuals were identified from recent return travel from China.
Are the at-risk individuals the same as the Senate category of persons under investigation who may be at a higher risk? Is that the same category?
We'll let the Commissioner answer that one too.
PUIs, or persons under investigation, is a higher category. So those are individuals for whom you are concerned they have direct contact with the virus, may have acquired the illness, or may have signs or symptoms of the illness with risk factors that make them high risk for it. The people we are surveilling are a much lower category. It's an abundance of caution. People who could have potentially had any exposure. So that's a much lower level. But when I say an elevated way to be careful that we're casting a wider net.
Has Kentucky seen any PUI?
No.
So I think that's another example of the preparedness that's out there, of how cautious we're being in the approach, but that also is making sure that we are ready if we do see the virus in Kentucky.
The doctors I've spoken with have said that in the event of widespread transmission, it would overwhelm healthcare systems. What systems are you considering or do you have in place in that event? Are there quarantine sites?
Well, I believe that what we are setting up on the preventative side is going to ensure that we don't have the type of widespread outbreak that would require those types of resources. But our goal is to be ready for everything. Our emergency management group here in Frankfort helps us prepare for the worst of the worst, whether it's natural disaster or an outbreak. But again, we want to make sure that we continue to communicate that we have no confirmed cases in Kentucky. We are actively taking steps to make sure that even somebody with a very outside chance of exposure is making sure that they are not going to work and that we have had only one person that has had any symptoms and they have tested negative. We will be ready no matter what comes our way, but again, we want to make sure those families out there that are nervous and that are worried know where we are here today. I don't necessarily think that's the case when we look at the overall numbers in the U.S. We're still seeing something that is rapidly evolving. They might not have thought that it would spread to the other countries that it has before, but when you look at the statistics as they are now, it is still so tied to China. I think it would be premature to say that, and our goal is to be ready to make sure that if we have one case, it doesn't turn into 2, 3, or 4.
There's been some discussion in the federal government about how much funding may need to be set aside to handle coronavirus. I mean, is that something that Kentucky would expect to try to draw down some funds for if it was necessary?
Well, if we end up in a situation where federal funds are needed, you can bet I will ask for them, and that we have tools from state of emergencies to others that we can bring into play. But we have this amazing network of local health departments. We have great public health officials that are out there that are already activated and ready. We have hospitals that are preparing for this, as you've heard from many of them. And so we have so many folks out there that are ready to respond, that if we are prepared, we will be ready for anything that comes at us. And not only do I think that we are certainly prepared given our risk level right now, we are further preparing every single day for it.
We have local health departments that are cash strapped because of the current typing crisis. Do they actually have the state resources that they need to be able to handle this, or could be preventative?
Well, we are working with them to make sure that we can step in, whether that is the state testing piece on that, but a lot of it is identification and then reaching out to whether it is the state or the local hospitals, whether we end up on the testing side. But again, the situation we're on right now has been self-monitoring that has been effective, and only one person with symptoms and them testing negative. But we'll be ready on the state level for whatever we need. I know our legislature will work with us on that, but I believe that our state of preparedness is not only good, but getting better every day. Anybody else? All right.